Hey everyone, today's video, me and my group mates are going to discuss about visual impairments and blindness given by a professor in Foundation of Special Inclusive Education. And I am Cerise Maria Cabal, and I am the one to discuss about the definition of visual impairments, the types, characteristics, causes, symptoms, and educational challenges, as well as parents or family involvement regarding of what visual impairments means. So before anything else, let me share to you one of his famous sayings of a Filipino-American rapper, a singer, and he is also a record producer who has this kind of condition. He is Alan Peñeda Lindo, or known professionally as Apple G App. He said that I doubted myself for a long time. I'm comfortable not using my vision. I wave around my problems. So according to him, his visual impairments is not a hindrance for him to do anything else that made him and others people happy. He said that he is comfortable not using and minding his vision because he used to it, and he find a ways to provide and resolve his own problem regarding his condition that cannot make him down. If you are familiar of Apple G App, he has an eye condition called nystagmus and is legally blind. So let's move forward to our main discussion. Let's discuss about what is visual impairment means. Visual impairment is defined as the limitations of actions and functions of visual system. Visual impairment means that a person cannot be corrected to a normal level, means whether it is someone who cannot see at all or someone who has a partial vision loss, because some people are completely blind but many others what's called legal blindness. Legal blindness means a person has corrected 20/200 in their seeing eye, but to actually fit the definition of legal blindness is that the person must not able to attain 20/200 vision even with prescription eyewear. Visual impairment changes how a child understands and functions in the world, can affect a child's cognitive by means of affecting his style of learning that encourage him to use his brain more effectively. Emotional development, where it affects his experiences, expressions, and understands and regulations of emotions. Neurological physical development, by possibly limiting the range of experiences and kinds of information a child is exposed to. The next are the common types of visual impairment. The first one is loss of central vision. It refers to either the sudden or the gradual loss of central vision. It involves losing the details in a person's vision and instead seeing one or more dark or blurry spots may grow in size or multiply over time. The second is loss of peripheral or side vision. It is the loss of your peripheral sight. Someone with peripheral vision loss can see what is right in front of them, but may have gaps in their side vision because they may feel as if they are in a narrow tunnel. The third one is blurred vision. It refers to a lack of sharpness of vision, resulting in the inability to see fine detail. Blurred vision may result from abnormalities such as nearsightedness, farsightedness, astigmatism that can improve with correction lenses or eyeglasses, or it may signal the presence of eye disease. The fourth is generalized haze vision or a cloudy vision. When it seems like you are looking into a haze or a fog, colors may look muted or faded, as well that causes lack of clarity in your eyesight. The fifth is extreme high sensitivity or light sensitivity. It is a condition in which bright lights hurt your eyes. Another term for this is photophobia, where the light level in the environment is too bright that causes discomfort. For some people, this discomfort can be extreme and can be further reduce their usable vision. And the last one is night blindness. It refers to inability to see well at night or in poor light or illuminated to poorly illuminated environment. So let's move forward to the characteristics, causes, and symptoms. So first, let's talk about these common characteristics of visual impairments. A child or a person with non-correctable vision problems have visual impairments depending on the severity of the conditions. in school or at work. A person who suffered from this condition may not be able to see objects at a distance, like on a whiteboard or on a chalkboard. Some people may be farsightedness or nearsightedness. Farsightedness means it is a vision condition in which you can see objects clearly, but objects nearby may be blurry. They can see objects or they can read what's on the board that are far from them, but they cannot see clearly if it is near. Nearsightedness is the opposite of farsightedness, in which you can see objects near to you clearly, but objects farther away from you are blurry. Having trouble reading or learning to read and having struggles in seeing clearly and attentively. For some reasons that they are not comfortable of their vision and having trouble in focusing because of visual impairments. Not be able to focus on objects or follow them may squint often or rub their eyes a lot, have chronic eye redness or sensitivity to light. A person often distracted. They may feel that there are something on their eyes that they always rub it, that cause redness and irritations. Most of them cannot focus in doing something. Bump into things more often. Most people have suffered visual impairments, have problems to see clearly, so they always bump into things more often. They often find themselves tripping over things and more. The other people say that they are the clumsy one, but in fact, they're suffering from visual conditions. The next are the causes of visual impairment, of why people suffer from this kind of condition. The first is injury to the eyes, like while playing or at work or due to the accidents may result in vision loss and impairment, particularly injuries to the cornea are the commonest cause of vision loss. The second is inherited condition of blindness and vision impairments. By means of acquiring the conditions from your ancestors or your parents or someone that transferred to you. The third is infections of the eyes. An eye infection is a condition that occurs when bacteria, fungi, parasites, and viruses infected the eye. Some infections affect only one eye while others affect both. The fourth is amblyopia. This is seen in squint or lazy eye, since both the eyes project differently and send in different messages to the brain. The brain may then turn off or suppress images from the weaker eye. This stops development of the weaker eye, leading to amblyopia in that eye. The fifth is cataract. Cloudy part or the entire lens of the eye. Cataract prevents light from easily passing through the lens, and this causes loss of vision. The sixth is diabetic retinopathy. Diabetes affects the small blood vessels in the retina. When damage leads to impairment of vision. The second is glaucoma. It is a condition results due to raised pressure with the eyes. The increased pressure impairs vision by damaging the optic nerve. The eighth is age-related macular degeneration. It is a progressive loss of visual acuity due to damage to the macula, that is most sensitive part of the retina. The ninth is AIDS-related visual impairment. Some people who has AIDS develop usually causing by viral infections of the eye that leads to visual impairments, and the last is cancer of the eyes. Types of tumors that start in various parts of the eye that leads to vision impairments. Signs and symptoms of the possible vision problems. If you experience any of the following eye changes, schedule an appointment with your ophthalmologist or optometrist immediately, even if you have been to your eye doctor recently. First, severe sudden eye pain. Second, recurrent pain in or around the eye. Third, hazy blurred or double vision, seeing flashes of lights or sudden bright floating spots, seeing rainbows or halos around lights, seeing floating or spider webs, seeing a curtain coming down over one eye, seeing a cup filling up with ink in one eye, unusually even painful sensitivity to light or glare, swollen, red eyes, changes in the color of the iris, white areas in the pupil of the eye, sudden development of persistent floaters, itching, burning, or heavy discharges in the eyes, any sudden change in vision. See also normal vision changes to help you understand normal age-related changes in the eyes and on your vision. Educational challenges of visual impairments. When vision loss goes undetected, children are delayed in developing a wide range of skills, while they can do virtually all the activities and tasks that sighted children take for granted. Children who are visually impaired often need to learn to do them in different way or using different tools or materials. Children with visual impairments can certainly learn and learn well, but they lack the easy access to visual learning that sighted children have. The enormous amount of learning that takes place via vision must now be achieved using other senses and methods. And the last that I'm going to discuss is about the parents or family involvement of visual impairments. Treating visual disturbances. The first step in treating a visual disturbance is figuring out the underlying problem that's causing it. Once your doctor has discovered the issue, they can help you develop a treatment plan. In some cases, the disturbance will go away naturally. The family provide information on the child's strengths and weaknesses at home, background information on the child's history and development, and information on any family factors that may affect the child's learning. It means that the family plays a significant role in the development of the visually impaired child. It is the parents who exerts the major influence on the development of the visually impaired child from birth to maturity. One of the most important attributes of parental attitude is consistency.